Next, I would like to invite our friend Sean Bashki from the co-founder and the global coordinator of the Digital Health Center for Excellence from UNICEF. The Digital Health Center for Excellence, or the DICE, is a new kid in town that going to leverage the digital health across the world, and we hope that we are going to work well with the DICE.
Thank you, Bunchai, and we look forward to learning and continuing to work with the godfather and godmothers in the room, the AHEN network. No, truly, this group here has been one of the groundbreaking consortiums, institutions in this space. I mean, the fact that 2011, you were already living these principles before they were developed, years before they were developed, is amazing, inspiring, and I think everybody in this room has a lot to offer, not only to this region, but again, I am really excited about how we can leverage not just the expertise, but the models, the approaches that you've successfully tested, often very painfully. I know this was not an easy journey to get to where you were today, but to be able to share these lessons with other regions who aspire to have these, not just these types of skills, but the investments that you've made, not only in platforms, but in people and process, which has really, really been inspiring. So again, kudos to the entire AHEN network for getting this far. I wanted to quickly talk about, similar to Merrick, UNICEF's transition over the last few years and how it may impact our support throughout the region. Several years ago, as UNICEF was developing the new strategic plan, the 22 to 2025 strategic plan, digital transformation came up as one of our core 9 change strategies. Formally recognized not as something that we do as a project here or there, but something that undercuts the people, the process, our work with data, and our work with platforms, and that needed to be fully mainstreamed. And so the unit that I sit in with UNICEF HQ really came out of this digital transformation effort, embedding the mandate to support digital health and health information systems fully within our primary healthcare strategy and within our maternal and child health team. I mentioned the digital transformation strategy because I think the work that you are demonstrating, the leadership you're demonstrating, provides additional opportunities to catalyze broader work within the governments and the countries that each of you operate. Digital health requires a number of larger digital public infrastructure investments. We spoke about national IDs, digital identity, and how this is a key driver for a lot of the patient level or longitudinal tracking systems that you are working on. And so things like birth registration in many countries, civil registration, that have struggled or stagnated, particularly in other regions. Africa, where I've spent most of my career, really plateaued about 10, 12 years ago, and hasn't been able to significantly increase the rates in most countries. Those that have, a country like Rwanda, what they did was they brought birth registration through policy reform into the health sector and the health centers. They furthermore started to use digital health tools, platforms like DHIS2, to immediately capture this data and link it to the national identity program. In Rwanda, this increased birth registration rates massively, approaching 90%. And this was really only due to health sector reforms and the digitalization of health sector services. And so one of the messages that I have to our UNICEF colleagues and our broader UN community is that we can't and shouldn't be looking at digital health only through a health lens. Digital health, by its nature, is multi-sectoral in how it touches with many other parts of social sector services and national systems. And so again, I think given how far ahead every country in this room is, you really can help piggyback, bear the weight, and support the rest of national digital transformation efforts, whether it is education, social protection, child protection. These are all areas that I think can benefit from the achievements that all of you have demonstrated. In the primary healthcare space, again, this is, I think, an area that a lot of the foundational investments, the work that you've done, really will help accelerate. We often talk about, for example, zero-dose children, zero-dose communities, with our COVID response and ensuring that every child is immunized. But as UNICEF, we like to think about zero-dose communities as communities where children aren't receiving any health intervention. A child that is not immunized probably doesn't have appropriate nutrition services. Their mother probably didn't receive appropriate antenatal or maternal care. And so, a lot of the tools that we're using to identify very specific deprivations often translate into a child that is being impacted from multiple deprivations. And so in the PHC strategy that we are rolling out, we're really looking at first health system preparedness and ensuring that we use this opportunity, these funds that have been coming in to address COVID, in order to address and build more resilient systems and ensure that we are better prepared for the next pandemic. The maturity modeling that many colleagues in this room have mentioned are core to this, really understanding how strong or fragile our systems are and the underlying components, and making sure that that is addressed. Yesterday, the talk from the IMAS team around some of the financial payment mechanisms that are being put in place, improving financial management. This is often an area not discussed in digital health forums, but really health work capacity and ensuring that they are incentivized and capacitated to work, and to work when systems are hit with acute shocks are critical. And again, strong, digitally enabled financial management and payment systems are really critical to this. Quality of care is another area that we're focusing on. Most of your digital tools, while they look at generating data for national usage to prompt informed decision making, we also want to ensure that these digital tools reinforce WHO clinical protocols, that we are ensuring that mothers and children receive the entire package of services, and probably, at least to me, just as importantly or most importantly, that there's accountability from the communities, the people that governments work with, that social contract, so that they know what services government is meant to provide, the private sector is meant to provide, and that they hold the service providers accountable for these services. And again, we're seeing digital transformation, digital health efforts really accelerating and connecting communities in ways that have not been connected before. And then finally, looking at community health. And when I say community health, it doesn't necessarily mean community health workers. In many cases, it does. Although many primary health initiatives can work through other models that may be more appropriate for your given country. But work around really being able to geospatially map where these primary care or community health services are being provided, using advancements in geospatial and population data to ensure that accessibility is there, that every mother, every child, every individual is within reach of critical health services, and using these tools to make sure that we are looking at individual health workers, making sure that they are provided with the knowledge, skills, supportive supervision, equipment, supplies, commodities, and tools to be successful. This room, your network, the investments that you made are really, really pushing the needle in ways that the global health community hasn't been able to do before. I think while the 10 years that it took you to get here was a massive journey, I think the next 10 years is going to be even greater. So be prepared to continue that hard struggle, because I know everybody in this room, and I know our non-digital health colleagues are starting to see the results of your incredible efforts and investments. But again, this journey has not ended. It's not just beginning, but we still have, I think, a very exciting and incredible pathway forward. And as UNICEF, I'm honored, I'm excited to be more formally part of the AHEN network and to join you or continue to work with you, given we've been working with AHEN in the past on this journey. So thank you very much for the opportunity to present, and looking forward to the rest of this conference.
Yeah.